Hello everyone. I am Sanjana, Onco nutritionist from ZenOnco.io. Today I shall be speaking about hypertension in cancer patients and how should be the nutritional intervention for that. Before moving ahead, let us try and understand what is the definition of hypertension as told by American Heart Association or AHA. Hypertension is also known as high blood pressure, and it is a condition wherein your blood pressure, which is the blood which flows through the vessels, the force of the blood which flows through the vessels is consistently higher. Hypertension is a modifiable risk factor. Now, what I mean when we say modifiable risk factor is that with regular physical activity and with a well balanced diet, and also controlling your intake of sodium or salt will help in reversing this condition. As per the American Heart Association, the normal blood pressure levels has to be anywhere between 120 by 80. Okay, and if you feel that your blood pressure levels are going beyond 130 to 139, which is systolic, and your diastolic is anywhere between 80 to 90, then yes, it is time to take action to normalize your blood pressure levels as well. So it is important to regularly get your blood pressure checked in understanding if you are at a risk of developing hypertension or not. There are various factors which have been shown to increase the risk of hypertension. It could be stress, it could be lifestyle changes nowadays which we undergo, it could be because of a sedentary lifestyle or even obesity as well. Now let us try and understand what are the objectives of the medical nutritional therapy for hypertension. First is to lower the high blood pressure levels and normalize it. Okay, next is to control the sodium intake to manage hypertension in sodium sensitive people, and also to promote the loss of excessive fluid or expanded extracellular fluid. Most importantly, it is also to control the body weight, and the body weight has to be such that it is in the ideal body weight range to prevent the long term complications of hypertension. So now lifestyle modifications is the first approach when we look at this, all right, and it has to be tried at least for 3 to 6 months before you actually go to a doctor and they are going to be putting you on antihypertensive medications as well. Now we follow a diet which is called as a DASH diet. When I mean DASH diet, the full form is the Dietary Approach to Stop Hypertension. Now, this approach has been used to control and prevent hypertension. It emphasizes on a low fat diet, inclusion of fruits and vegetables, and reduction in the fat intake as well. Also, reduction in sweets and meat intake. So, as per the DASH diet, yes, it is essential to incorporate seasonal and fresh fruits and vegetables in your diet, which are also going to help in controlling your cholesterol levels as well. Fiber also has a property of helping in reducing the cholesterol levels by binding to the cholesterol so that it does not increase. Also, you need to, yes, reduce the intake of fat. That doesn't mean that you're going to be restricting your self by eating fat. No, there are also healthy fats which are there, which are also heart friendly, and mainly we look at is your omega 3 fatty acids as well, and also a combination of monounsaturated and polyunsaturated fats as well. So you can include cold pressed oils and you can include nuts and seeds in your diet, which are also rich in omega 3 fatty acids as well. Yes, and it is also important to reduce the intake of sweets or even meat, because again these are something which are high calorie and they have excess of sugar, which can also again contribute to weight changes. And yes, sodium intake for patients who are having hypertension is at least 4 grams in a day. So we need to be very careful while choosing the foods which you would like to incorporate. Yes, nowadays in the market we come across foods which are highly processed. They have so many preservatives which have been added to them. All of these contain a high amount of sodium, which can again put us at a risk of developing a high blood pressure. So we need to be very cautious while we are choosing what kind of food we would like to eat. To conclude, yes, it's important to control the blood pressure levels. Though we might be taking medications as well, we have to control our blood and regularly monitor our blood pressure levels, and also incorporate a well balanced diet, and also we need to give emphasis to the DASH diet as well. Thank you so much for watching my video. We at ZenOnco.io are here by your side to navigate you through your cancer care journey. In case of assistance, you can surely reach out to our cancer coaches on the below mentioned contact number. Thank you.